Medical practitioners are advocating the integration of maternal mental health into primary care settings to improve early detection and treatment. At the summit in Lagos, Nigeria, medical practitioners say advocacy, awareness, and treatment remains a public health priority. Correspondent Funke Adesoji reports.
Globally, around 10% of expectant mothers and 30% of postpartum women experience mental health disorders, with perinatal depression being the most prevalent. The numbers are much higher in developing nations like Nigeria, where the prevalence of perinatal depression affects between 10% to 30% of women. As Nigeria continues to face these challenges, there remains an urgent call for support systems.
It's called perinatal mental health. So it's anything all the way from pregnancy all through to 2 years postpartum. So it's not only something that happens when you're pregnant or at postpartum. So it can happen anytime during that perinatal period.
The government has put things in place to make life much easier for pregnant women and even struggling women that are trying to conceive. There is also the fact that it has been made clear that this issue does not only affect the woman and her family, it's also a community issue at large.
According to medical practitioners, maternal mental health conditions common among new mothers are often undiagnosed and untreated, leading to adverse effects on both the mother and child. Limited access to mental health care services, coupled with stigma and cultural beliefs, compounds the problem, making it difficult for women to seek help.
The environment is a key factor in the well-being, in the natural well-being. How you take care of your environment, how you dispose of your waste, how you allow in naturalness, into your home, natural flower, natural light, openness, with a natural air. You understand? They all have biological benefits.
For postpartum depression, there's a generic word, which means it has been something that a lot of people have been aware of, but it has been highly stigmatized. And often the interpretation of why those things exist is what has been wrong. So it is the narrative that we're changing now. So if you hear things like Abyssinian, you're actually referring to postpartum psychosis. But that terminology is very stigmatizing when people hear it. Okay? So it's part of the work that we need to do around changing those narratives, and that is the reason why I'm happy that these conversations are coming up more now than before.
One of the factors that precipitates this is young mom, lack of understanding, bitterness or fighting in the family, or lack of support where needed. And most of these teenage pregnancies, they are attributed, which is more commoner, far not. And so we find out that when they are given this support, everybody will be able to work within that frame of mind.
Stakeholders here suggest eradication of social stigma surrounding mental health, especially for women, which discourages open discussion and seeking help. They also say traditional beliefs that equate mental health struggles with spiritual weakness or personal failure were other issues hindering women from acknowledging and addressing their mental health needs. Funke Adesoji, STV News, Lagos.